Good morning, everybody.
Morning.
So, y'all, I am Congresswoman Nikema Williams, and I proudly represent Georgia's fighting 5th Congressional District. And I thank everyone for coming out this morning in a little rain, but this rain is not going to stop the movement that we have growing here in the United States Congress. I am proud to have my co-conspirators for health equity and justice joining me in this movement so that we can fund women's health equity. Congresswoman Alma Adams, Congresswoman Lauren Underwood, and my co-chair of the Congressional Endometriosis Caucus, Congresswoman Jennifer Gonzalez-Colon. The reintroduction of the Endometriosis CARE Act, y'all, it marks a renewed fight for funding to support millions of overlooked women, including myself, suffering from endometriosis. So I know and I see and I feel your pain monthly, y'all. This is something that I have experienced since I was 14 years old. This legislation will help ease the burden of endometriosis by investing in the research necessary to make critical advancements in treatment. The bipartisan Endometriosis CARE Act is being reintroduced today. Y'all, this fight is personal. I've battled excruciating endometriosis pain since I was 14 years old. For far too long, my doctors ignored my pain or asked me if I was exaggerating. The pain would cause me to miss classes as a freshman in high school, family events that I desperately wanted to attend, and even to this day, it sometimes gets in the way of my working for the people that I was sent here to serve. After changing doctors to one who would finally listen, I learned that the pain had a name: endometriosis. Unfortunately, far too many women never get the answers that they need or deserve, and they have to wait years to get those answers. Studies show that on average it takes any woman at least 7 to 10 years before receiving a proper diagnosis, and it is estimated that Black women were 50% less likely to be correctly diagnosed with endometriosis and instead misdiagnosed with pelvic inflammatory disease. This misdiagnosis, the limited treatment options available, the physical and financial burdens of endometriosis, all of this is the direct impact of ongoing disparities in women's health research. And that's what we aim to change with the Endometriosis CARE Act. The Endometriosis CARE Act would invest $50 million annually for 5 years in the endometriosis research through the National Institutes of Health. These research investments are necessary for the innovation to create more medical treatment options. Right now, treatment options are limited and often involve surgery, which is a burden in and of itself. I had my first surgery at the age of 14, and that's how I was ultimately diagnosed with endometriosis. The Endometriosis CARE Act will also provide us with a better understanding of the condition, and in particular, the disparities in the prevalence, detection, access to care, and treatment outcomes. The Endometriosis CARE Act will commission a nationwide study that will help us answer the unknowns that still exist in terms of endometriosis. And finally, the Endometriosis CARE Act will help bring light to the disease that is often not even talked about by establishing a national campaign for public awareness. A lack of awareness of endometriosis means that often people living with the disease, they don't even know the questions that they need to ask when they're seeking treatment. For far too long, endometriosis has been underfunded and overlooked. But y'all, it doesn't have to be this way. President Joe Biden issued an executive order in March calling on Congress to invest $12 billion, with a B, y'all, in funding for women's health research. And we stand ready to answer President Biden's call, and we can start by passing the Endometriosis CARE Act. Thank you for coming out today, and thank you for helping us bring light to endometriosis. And now I am going to turn it over to Catherine Schubert, President and CEO, Society for Women's Health Research.
Thank you so much. Thank you, Congresswoman, and thank you for sharing your story. Unfortunately, Congresswoman Williams' story is not uncommon when it comes to the story of endometriosis, and I think you'll all hear that. I'm Catherine Schubert, President and CEO of the Society for Women's Health Research. We're a national nonprofit dedicated to advancing women's health through science, policy, and education. And we look at issues that differently, disproportionately, or uniquely impact women, endometriosis being one of the most important ones that we are looking at these days. And we are thrilled that Congresswoman Williams and Gonzalez-Colón, Congresswoman Underwood, and Adams are coming together to reintroduce the Endometriosis CARE Act. And we are so appreciative of your leadership. So thank you. So historically, women's health care has received less attention, research, and funding, and that's impacted women's health outcomes today. And that gap is really rooted in historical bias. In fact, until about 25 years ago, women were not required to be included in clinical trials at the National Institutes of Health, and it wasn't until 2016 that female mice had to be included or considered when it comes to basic research. So we are at a disadvantage when it comes to women's health research. And this gender health gap has resulted in a variety of disparities in the health of women, with endometriosis being one of the biggest ones. It impacts an estimated 11% of American women between the ages of 15 and 44. We think it's a lot more than that, but we do not know. As the Congresswoman mentioned, it takes between 7 and 10 to 11 years to diagnose endometriosis, and most treatment options only deal with pain and symptom management. And in order to be diagnosed, it does require surgery. More research would mean more answers for a disease that's still very misunderstood. And if we can better understand why people have endometriosis, we can work towards shortening the diagnostic delay and provide treatment options that are safer and easier. And maybe at the end of the day, we can prevent this from even happening in the first place. There is an estimated cost to this at the NIH. The current budget allocated is just $2 per patient, so an extra $50 million per year would go a long way in helping us get these answers that are needed. And I would just say that my sister and my aunt have endometriosis, and quite frankly, I do worry that my 13-year-old daughter may also have it, given our family history. We believe it to be much more prevalent even within the family. That's just what we know. Our own program is working to support this legislation, to support the work of the Congresswoman and the caucus to make sure that this legislation gets passed. And hopefully with passage of the legislation, we'll see more research, better care for those living with endometriosis, and to really work for the future of our women and girls. Thank you. I'll turn it over to Dr. Martin.
Congresswoman Williams, thank you for coming out today to reintroduce the Endometriosis CARE Act and for supporting treatment, research, education, and equality in all women. We hope to improve the lives of those who suffer from endometriosis with this infusion of money into our resources. We are glad to receive the renewal of the emphasis of care on the 10 to 20 million who are diagnosed with endometriosis, and a larger group, perhaps, who are not diagnosed because of the inequalities of care, lack of education, lack of access to care, normalization of pain, and the other factors that interfere with women receiving proper care. Increased awareness and earlier treatment of pain in adolescence. We don't need to wait 6 to 10 years to do something. We can start in adolescence without a diagnosis. We can treat pain as though it might be endometriosis and preempt this. In a study in Australia that resulted over a 10.2 year period of a decrease in the severity of endometriosis in the patients who had it, and may have decreased the occurrence. On the other end of the spectrum, Congressman Williams has already told us we have to do something to decrease this 6 to 10 year delay in diagnosis and treatment of advanced endometriosis. Those need earlier care and treatment. Thank you for supporting this important bill. We hope that it's going to be successful. Thank you.
Thank you so much.
Lauren.
Good morning, everyone.
Good morning.
My name is Lauren Cornegay, and I'm the founder and executive director of Enzo Black. I'm not only here as a representative, but also as a patient advocate and someone who has battled with endometriosis. As I've mentioned, I battled with endometriosis. I was diagnosed at the age of 20 while attending Morgan State University in March of 2011. This is a disorder that affected my entire life. I've been faced with numerous challenges, and I completely understand how people have been struggling with this disorder. If you haven't heard all of the statistics and the resources that they have already shared, I'll just share. Endometriosis affects an estimated 1 in 10 women of reproductive age, yet it remains under-researched and underfunded. This is why the reintroduction of the Endometriosis CARE Act is so critical. I am proud to stand here to support this vital legislation. We're immensely grateful for Representative Dr. Lauren Underwood, as well as Representative Nakima Williams and the Endometriosis Caucus, and all of the work that they have been doing to push this forward. Their leadership and dedication to women's health are making a profound difference in the community that we live in. The Endometriosis CARE Act is a significant step forward in creating a future where early diagnosis and effective treatments are the norm, and the burden of the disease is significantly reduced. You've heard people talk about teenagers having endometriosis. So it's really important for us to push this legislation so that we can impact our future generations. It's about ensuring that future generations do not have to endure the same thing that we had to endure. The legislation also aims to provide the necessary supports for research, enabling us to better understand the condition and to develop effective treatments. It also focuses on increasing awareness, which is crucial for early diagnosing and improved care. Again, I just want to say, in conclusion, the reintroduction of the Endometriosis CARE Act is a beacon of hope and a progress for all of those impacted with living with endometriosis. Thank you to everyone involved, and thank you for everyone who is listening, watching, and here with us today. I'm going to now pass it over to Shannon Cohen, who is the director of EndoWay. Thank you.
Thank you. Thanks, Lauren. Thanks, everyone. I'm Shannon Cohen, and I am a film director and producer, a lawyer, and a social impact builder. I stand here today as a woman who lives with endometriosis. I know firsthand the impact on the millions of lives that it makes. I first had symptoms, like many of the people standing here, as a teenager. I first had symptoms at 16, yet waited 13 years when I was 29 when I first heard the word endometriosis. And now I have 2 young daughters who have a 7 times increased genetic risk of having this condition. And finding effective health care in the United States today. I stand here as an attorney and also a women's health advocate because this is a social justice issue. Endometriosis and women's health is a social justice issue. It's a perfect awful storm of so many things that we see. Menstrual taboo and stigma, gender bias in medicine, racial bias in medicine, misinformed doctors and barriers to health care, whether they be financial, cultural, institutional. And the answers to all of these issues lie in research. A transformative amount of research funding is needed, and the time is now. So thank you to our esteemed Congresswoman Williams, and all of the co-sponsors of this bill, because it is so necessary. And also to Senator Romney, Senator Warren, and Senator Marshall, who just a few days ago wrote a letter to the Senate Appropriations Committee echoing this call to action. So it's going to take all of us working together. And I know that for all of us standing here, the millions of people who have endometriosis, my daughters who have a 7 times increased risk, and future generations of daughters, this is why we're here. So thank you very much, and I'll turn it back over to you.
Thank you, Shannon, and thank you to all of our speakers and our experts and advocates for being here with us today. And we will now answer any questions. I think everybody just wants to get out of the rain before the sky opens up. Thank you for being here. Thank you all so much.
Thank you.
This is so important.
Oh, I know. I was like, oh, it's
You gotta have men in the fight with us.